The potential of the STAR system is to be able to help patients with spinal metastases and improve their pain.
It's the only option right now that really works for these patients.
But the pain in my back kept me from living much. I didn't have much quality of life.
Looking at the available techniques for palliation of our patients, we have available radiation, we have available systemic therapy, we have obviously pain medications.
I didn't want to take pain meds, but it got to where I had no choice. I needed them just to get the pain level down enough that I could live.
These patients have to undergo radiation treatments. Those are multiple treatments, and oftentimes they have to stop their other chemotherapeutic agents.
The level of pain in my back was at least an 8. It was very severe.
Sometimes I have to do them just to get the patient on the radiation table. They're in so much pain.
Important thing about RF ablation is that besides pain control, it also is convenient for patients. It means one treatment the patient can undergo instead of several days of radiation therapy, and it can give quick pain relief, which again is extremely important for patients with metastatic spinal disease.
I did have radiation where they could target just the bottom half of that vertebrae because it didn't have the maximum yet. But that wasn't targeting enough to take care of that tumor. It didn't work.
You won't have immediate relief. Very few tumors respond quickly to radiation, instantaneously. And about 15 to 20% of the patients, you don't see any relief. There's no difference.
Really offers us a lot more options than we've ever had.
There's a lot of oncologists that have never heard of this procedure before, or maybe don't have a lot of faith in it. There may be misconceptions as to, well, if they get this procedure, then they won't come back and get their radiation treatment, or they won't come back and get their chemotherapy because they'll be out of pain. I think once those physicians have a few of their patients go through this procedure, they see it's just the opposite. They're actually more likely to come back because they're in less pain.
I had lifetime maximum radiation to that area. Couldn't have any more radiation, and the chemo wasn't really taking it out, so I needed to find something else to take care of that.
You can only give so much radiation to the spinal cord, and that, so then they're really out of options. So I think it's going to play a huge role in the treatment of metastatic spinal disease.
I think this is the only option for most of these patients now.
I was amazed. After the surgery, I already felt a difference right away.
You look at the patient's relief, it goes from tears of pain to tears of joy, and it makes you feel good as a physician.
My pain has gone from being up around an 8 to being about a 2.
When you show referring physicians this kind of technology, they're just amazed.
I'm off of all pain meds now.
Physicians see how well their patients do immediately afterwards. They're exceedingly happy about it.
I would recommend this procedure to anybody that has spinal tumors. Now I don't have to spend my life in bed anymore. I'm up and about. I went to a birthday party last night. The first time I've done something like that in months.
One of the reasons that I became an oncologist is because I can help patients even a little bit. I may not be able to cure everyone, but even helping with their symptoms meets my goals. And having a system such as RF ablation available to me is extremely important.